How you doing, guys? So this is Dr. Specific Chiropractic. So we have a special guest over here that's presented with Spondylolithesis over here. All right. So close to the viewers, I understand you came here originally for the low back pain. What else has been going on, and how long have you been dealing with this?
My left knee always pops out, and also I just feel like I don't know. I just can't live normally with my back hurting all the time. And this has been happening since 7th grade, or for a couple years, because I just put a lot of pressure on my back when I was young from playing my instrument. So
we're talking about the past 5 years has been going on?
Yeah, 5-6 years.
5-6 years, okay. So this is what we're called a spondylolisthesis over here. All right. There's supposed to be a bone connected from these two over here, but you can see there's a clean, the space right over here. And we also see the sacrum over here, it went backwards, and the rest of your bone, the rest of your spine, everything went forwards. So, to show to the viewers over here as well, and to you, okay, now, see these bones over here?
Yeah.
We want these bones in place, all right? Now, because those bones are in place, just like an elbow or a knee, no matter how much I push it forward, this is not gonna go past 180, okay, unless you break it, right?
Yeah.
So, if we break both of these sides over here, okay, I'm gonna retract it a bit, I'm gonna reiterate it again, okay? So normal, no matter how much I push forward, there's no way this is gonna go forward.
Yeah.
But if you break both of those, then, and only then, it'll go forward. So, right, so I don't know if any of the other doctors mentioned that to you, but this is what you have over here. Whereas your spine, it went forward on top of your foundation. So this is what we call a spondylolisthesis, okay? So there's going to be two particular solutions what we have for this, okay? You may get surgery for this, and what they'll do is they'll put a bolt here and they'll put a bolt there. Yeah. Unfortunately, there's, I don't know any surgeons who's willing to just realign it. So they're going to keep a bolt in that position. And as a result of this misalignment, as you see, it goes all the way straight up to the very top. Now it's a little hard to see the viewers because it seems like it's upright, but when I take a closer look, I'm looking for these pedicle shadows and this spinous process. So right now your spine is twisted like this, okay? And it rotates this way, and it rotates like this, rotates that way, and this way again. Okay? So there's a lot of
twist.
Yeah, as long as your body's twisting like this, so much. Keep on going up this way, and in order to protect the brain stem, okay, and your spinal cord from twisting so much that it's going to rip and damage. This is the final circuit breaker. Your body has no choice but to flip the circle curvature opposite direction. It's supposed to go this direction, not that way. Yeah, it's quite a bit. So whenever I see something like this, that tells me, wow, there's something that happened way below it that twisted so much. Yeah. So because you don't have a foundation that's anchored in place, okay, you can't anchor it anymore. Now it's like this.
Yeah.
And the rest of your body, because you're still moving your body around, it's causing other twists and rotations around as well. Yeah. So that's what's going to make this challenging over here. As I mentioned before, that's one solution. Surgeon's going to bolt here and bolt there. But the problem is, all that twist is still going to stay there. Yeah. And the twist is so much that I'm seeing a lot of biomechanical tension. Yeah, you can see this over here, right? So there's so much tension in the mid-back, it's irritating the nerve that goes to your stomach. Right? This is your stomach over here. It shouldn't be this big. So that's why I'm going to ask you, you ever felt any indigestions, heartburns?
Is it my stomach's big?
Yeah.
That's funny because I feel like I can't eat that much.
It might be because there's too much gas in there.
Yeah.
Because a normal amount of gas in the stomach should be like the smaller amount.
Yeah.
That's it. Not this big amount over here. Okay.
Oh
yeah, and we see it over here too. This big amount. So I'll show it to you over here. See, this is what I was seeing on the x-rays. We have two sphincters in our stomach. Okay. This one seems to be closed. Okay. Now this one, when it opens up, everyone's more familiar with this. All the stomach acid goes up, heartburn.
Yeah, I don't get it.
Correct. So that's what I'm also seeing in the x-ray as well, because if this was open, I wouldn't see any gas in here anyways. Right? But this is open, the bottom part. Okay. Now, because you have some mild constipation down below, all the byproduct, the gas from the bacteria and the yeast still breaking down that food, it travels just like a sewer backing up the kitchen sink, goes up to all the intestines and gets stuck, trapped right in your stomach. Right? That's what I'm seeing in the X-ray. Bingo. So that's why it's important that eventually I want to clear that traffic jam over there, reduce that subluxation, get the nerve working again, so we close that off. That's what's causing that Megan blast. Now here's what we propose to do, right? The other option, if you don't want to get surgery, is that because this foundation went backwards, I'm going to nudge it forward to line it up with the rest of the spine. Okay?
Yeah.
Now this is not permanent because you don't have a bone connected there anymore.
Oh,
right?
so it's just like...
So the only thing that's holding you together right now is nothing but muscles and ligaments. That's it.
Oh.
Yeah. So that's why it's going to be very key and important. We're going to give you some, some core exercises and hip exercises to strengthen it up. So, because again, the only thing you get is just muscle and ligaments. That's it.
Yeah.
So if you really want to try to keep that low back pain, at bay and try to keep it stable as much as possible, you got to do those particular exercises. All right.
Yeah.
Now, that still doesn't address the other issue as well. Most likely during examination, I wouldn't be surprised we find a sacrum problem that needs to be addressed. But the more long-term problem I also see is that this problem over here. Your pelvis is sinking down a bit on the right-hand side. It should be level. So even though I adjust this thing, eventually it's going to make this thing drop even more. Right? So this is an old problem you've been having on the right-hand side, the right hip. Okay. So in the future, I'm going to keep an eye on that and re-level it. But because, once again, since the rest of your spine is like rotated, twisted that way, it's also irritating that fourth lumbar. And that nerve goes over to your knees. So I'm also going to take a closer look on your knees, see what's going on with that fellow. Now the knee x-ray itself, well, the good news I like to see is that your kneecaps are smack in the middle. Because if your fourth lumbar nerve really is compromised and there's a lot of traffic jams in there and not much nerve going into there, traditionally the nerves, the fourth lumbar nerve goes to the vastus medialis oblique muscle. That's what these two muscles inside here. Yeah. Okay, the inner thigh. Okay, so but because the outside muscles are still working, it will pull the kneecaps outwards. I don't see that. It's slightly on the outside, very slightly, but for the most part, no.
Yeah.
And that's another good reason why is because of that spondylolithesis you have over there. The reason why I don't want to try to adjust that fourth lumbar and push it forward, your body's already forward.
Yeah.
Compared to the foundation. We don't want to make that even more forward. You wouldn't like that. You wouldn't be happy. Okay? So now this is a very advanced thing. It's very rare, but I do it when the examination calls for it. This is for information for the young docs and the students here. Okay? If this does show up anytime in the future, I do what's called a finger push maneuver. That means my primary purpose is trying to take the rotation out, because this bone is rotated quite a bit this way.
Yeah.
Now, when I try to do a finger pull, okay, I try not to push it forward. My main concern is, okay, let's try to recenter it.
Yeah.
Okay, but that's going to be very, very super gentle because, again, I don't want to move this forward any more than it really has to be. Okay.
Yeah.
And of course, that only shows up very rarely. But I'm still giving you a heads up. What I am going to keep an eye on is this right hip. All right. I'm going to see if this one needs to be adjusted today or this sacrum over here. So we're going to find out in a moment, see what's going on with that fellow.
Okay.
Okay. And the rest of the body, no, I don't want to address that one. I understand you may have experienced some TMJ from time to time.
Yeah,
okay?
but that's like the least of mine. That's the only surgery.
Yeah, so again, I want to see what's going on over here. Just in this, it may calm this down quite a bit. So we'll take a look at this one. But yes, you do have a TMJ because this is not the same height. Everything's like twisted a bit, rotated. So by addressing the root cause of the rotation, it may help calm down, there's Megan blast over here, and also that TMJ over there as well. So the viewers can see over here, look at that, this is all, everything's swollen. And again, there's no big surprise because there's so much rotation down below. So yeah, that's all puffy right here. It's all puffy here, swollen. Yeah, see, it's all puffy and swollen here too. Tender right here? Not too bad. What about here? Not really.
I
All
think
right.
I kind of like up there.
So this device here is going to measure that difference in temperature that's given off from an irritated nerve, indirectly that is. So this is going to allow me to identify some potential areas we want to take a closer look at during examination. Not bad. Okay. That's moving just fine. Feel that fella right there?
Yeah.
It's a little bit stuck right there. This is stuck here too. How's that fella? Not too far, right? Yeah. Okay. So sacrum is more fixated, more swollen tender compared to the right hip. Okay. How's that fella right there?
It's okay.
Not too bad, right? That's a fourth lumbar.
I feel like I always have to like I have to squeeze my abs all the time. Like if I move it, or else it'll like hurt too bad if I just like completely like let loose.
How's this fella right here?
It's okay.
Decent, right? Not too shabby. How's that fella? Not too bad?
Not bad.
Yeah, that's what I figured. Most of it's compensation. Okay, so let's get to work. Set that profile in place. Glasses? No.
Oh my.
Walk around.
Oh my god. It really feels like less tension on this side. Also like, cause the thing is over here it used to hurt a lot when I would like let go in like my hip, and now it doesn't feel like, it feels like more loose. I don't have it like pain in the hip.
Any other difference? How's your jaw? Check that out.
I don't know. I feel like it's like loose.
All right. Okay, let's check your knees. So the left knee, that's been bothering you how long now?
I first noticed it like maybe like 2 years ago, but I'm not really sure like how specifically how long. But yeah, like always, like no matter what, like all the time, like I have to be careful because it always like pops. And if I do like, let's say like leg extensions, one time it like popped and it was like hurting me for like a week.
Gotcha.
And I was like, wow.
Okay, so now part of the component, the reason why it's popping and unstable the way it is, because keep in mind, your sacrum itself, okay, it went backwards. Your spine went forwards. Okay, so also not only went backwards, but also your right hip also went backwards as well. Same time. Okay, so that's not exactly a good combination, and it rotated this way. So since your sacrum rotated that way, and this also rotated, also went like this way as well, get backwards, and also rotated this way, it's twisting that pelvis. So when it twists the pelvis this way, your knee is taking some of the brunt, it's trying to rotate the other direction. Okay, so this is like a compensation that's slowly turning into a subluxation. All right, so we're gonna assess this knee over here, and also what I'm seeing in the X-ray as well, it looks like an A-line femur. Okay. So now what I'm looking for is, see the stability over here? This is nice and stable. It's not moving, that's normal. But when I go on the medial side, feel how much give there is?
Yeah.
Okay, loosey-goosey right over here. So that tells us, no, we got a femur problem. That's this bone over here.
Yeah.
And you feel that puffiness right there?
Yeah.
Okay, so this is your medial meniscus right over here. It's swollen. Okay, I'm not saying it's damaged, okay?
It's like swollen.
Yeah, it's just swollen. It's just not happened. I mean, yes, there's a mild damage, but I'm not saying it's like, you know, torn or what have you. So we're just gonna nudge this meniscus just slightly back in because this is not too bad. Okay. And we're just gonna wait until this fellow sinks back in. Feel that thing? It starts to sink right back in. Just like that. Now we're gonna test it. See this? Now it's moving. See the slight little fixation. We're just gonna nudge a little more. Just wait until the meniscus just goes right back on its track. Here it goes. Sink it a little more. It's a very subtle, gentle nudge. You feel that, right?
Yeah.
Pretty wicked, huh?
Yeah, that's weird. I never felt like in my life.
I know, feels kind of weird there. I hear you. See how much it moves now? Yeah. So now we're gonna do a nice little gentle set. We're gonna set the rest of it in place. Just got a nice little quick like that. Go ahead. Now walk around. So you like that knee?
Can I do like squat test?
Yeah, sure.
It still like pops.
Oh, can you show it to the viewers again? Actually, no, let's have you stand over here. This. Okay.
And when I got low enough, like, you hear that?
Slightly. Yeah.
Slightly.
But here's the other challenging component, as we mentioned before, because you have that spondylolisthesis, right? Right, because of the back, you're still not having a lot of the fourth lumbar nerve go into that knee to allow the ligaments to hold that knee, make it more stable. So there's always going to be a little bit of challenge, and on top of that, I still have not addressed that right hip yet. That's a future visit problem that we need to address back then. That's what in that. Okay.
Yeah.
All right. Let's take a look, see what else is going on. Have a seat.
I think so far, definitely, like, even when I'm sitting right now, like, I used to feel, like, in my right hip, like, my pelvis, like, bad pain, and now I don't feel it. It's just only, like, my back now.
Nice.
Like, oh.
Okay, open, close, open, close, slightly out. Okay, open, slowly close, open, close, open, close, open, close, open, close. Okay, get a little more out of it. Open, close, open, open, close. Oh, this is slightly as well. Open, close, there it is. Open, close. Okay, go ahead, stand up.
I don't know how to describe it. It's just like my overall like body, it just feels like better.
Well, how's the jaw itself?
It's looser.
Yeah.
I'll see how it is like tomorrow, but it's definitely like better now.
Yeah, that's what it's all about, okay?
Yeah.
Okay. All right, so here's your homework, okay? You're gonna follow our cold pack, protocol for this one over here, right? And then we'll see you the next future visit there.
All right.
All right?
Thank you so much.
Oh, you're very welcome.